I am Dr. Rajiv Siwach, Director and Senior Orthopedic Surgeon of Saraswati Hospital and Siwach Orthopedic Center. Today's topic is education of the patient for active lifestyle. Today I am going to dwell on the ways and the need to have active lifestyle so that the patient has a better quality of life. Importance of musculoskeletal health. Musculoskeletal health plays a key role to keep up good mobility and dexterity in an individual, along with enhancing their ability to work and actively participate in all aspects of life. Good musculoskeletal health is also crucial to maintain economic, social, and functional independence across their life course. Physical activity plays an important role in reducing the risk of other non-communicable diseases. What is the level of physical activity? Relationship between painful musculoskeletal condition and reduced activity or reduced capacity to engage in physical activity. That means once a person is bedridden or senile or due to this lockdown phases, lack of activity, there is sudden loss of muscle mass, loss of bone density, and also loss of enthusiasm. All these leads to senile osteoporosis and tendinitis. We have noticed that because of this repeated lockdowns, the behavior of the people have changed. They have started remaining indoor most of the time. They are not coming out, and due to their changed behavior, there is a lot of osteoporosis and tendinitis patients coming to us because of their inactivity. Young patients, I tell you. So the regular exercises to maintain their muscle mass and bone density is a must. There is a direct correlation with the activity and the muscle mass and the bone density. Impaired muscular health can lead to acute and chronic pain, causing physical limitation, proceeding loss of participation and withdrawal from usual social community and occupational activities, further decreasing their quality of life and well-being, including mental well-being. Impaired muscular health can lead to substantial personal, community, and societal consequences, particularly in older people. A strong relationship exists between both, as I have told you earlier. Once the patient is bedridden or forced bedridden or forced housebound because of lockdown, they we have noticed that after the osteoporosis and loss of muscles, patient becomes depressed also. Because of depression, there is a decreased enthusiasm, there is decreased initiative, and also decrease in the work productivity as well. So even after lockdown or due to some illness, there must always be a program to include some activity so as to keep the infirm, senile, or disease patient some activity, some physiotherapy, or some activity should always be there. I know the Indian Spinal Center, Delhi, it has got the best rehabilitation center. Quadriplegics, paraplegics, they are made to engage in so many activities, including table tennis, carom. At least that gives them idea of social well-being. They're also engaged in painting. In quadriplegics, I have seen patient doing painting with a brush held in their mouth. So the idea is that even if you are infirm, even if you are fit, daily exercise of around 2 hours is a must so as to maintain you fit for a longer years together. Most importantly, impaired muscular health causing reduced physical capability like grip strength, walking speed, chair rising, and standing balance has been frequently linked to increased mortality. Thus, weak musculoskeletal health is a key component of frailty. What is the impact of impaired musculoskeletal health? The impact of impaired muscular health is now recognized globally with an increase in morbidity and mortality related to it. Good musculoskeletal health is crucial for maintaining an active productivity and prolonged working life. With an increase in global retirement age, maintaining good musculoskeletal health will now become increasingly important for older workers as many occupation and work-related activities are associated with musculoskeletal disorders like low back pain, shoulder disorders. It is important to identify and implement effective intervention for people with musculoskeletal conditions to remain productive at work. So, we being physicians, surgeons, physiotherapists, doctors, it is our moral duty to find out the cause of take care of that musculoskeletal infirmity, and with the help of physiotherapists, the gym trainers should devise activity exercises for individual need of the patient. High income countries observe musculoskeletal conditions to be one of the major cause of work loss, early retirement, and lost retirement wealth, while developing countries see musculoskeletal conditions to have a major impact on their livelihood. Thus, reduced musculoskeletal health results in reduced productivity and economic loss to society at all levels. Since musculoskeletal conditions chronic, painful, associated with disability and social disengagement, frequently causes mental health impairment such as depression, anxiety, and Alzheimer's as well. Physical and mental aspects of quality of life related to health are known to be greatly impacted in persons with multi-morbidity. Unfortunately, this impact is even greater when there is an associated musculoskeletal conditions. Non-communicable diseases now account for the most of global burden of disease, with musculoskeletal condition being the leading contributor. Developed countries well recognizes the transition of burden long-term disabling condition. However, now low and middle income countries are also demonstrating the enormous future impact from musculoskeletal conditions such as osteoporosis and low back pain driven by population growth and aging. Since age remains one of the most common risk factors for musculoskeletal conditions, it is estimated that by 2050, there will be 5 times as many people from over 40 years living in developing countries compared to wealthier countries. The World Bank additional obesity, another important risk factor for many musculoskeletal conditions, is also expected to rise dramatically in the developing world over the coming 2 decades. Furthermore, increased use of motor vehicle is not only reducing physical activity but also increasing the number of motor vehicles, resulting in musculoskeletal trauma and disorders. I have been to US and I have found the obesity level is very high in these developing countries or the developed countries. Young people around age 30, 35, they are using powered wheelchairs for going to markets and supermarkets. They are unable to walk slight distance without the assistance of these wheelchairs. And their countries, their social welfare department, they are providing them these powered wheelchair free of cost, just to improve their life. That shows the importance of musculoskeletal activity as we are a developing country. We are gradually also becoming more obese day by day. So, to enhance our productivity, we must not ignore this part of musculoskeletal health. Obesity leads to increase in fat mass while decreasing the muscle mass. I mean to say, once the patient or the human being becomes obese, what happens with aging? He loses the bone mass, BMD, bone mineral density. He loses the muscle mass also, and instead gains the fat. So overall, weight is not increased much. Say if he is 72, so he becomes 72 or 75, but actual muscle mass is lost. And instead, muscle mass is lost and that is converted into fat. That also decreases the efficiency and activity level of the patient. So this thing is also need to be recognized. that maintaining your weight doesn't mean that you are not becoming obese. So it is more important to have a good muscle mass rather than the equivalent amount of fat. Sustained and systemic urbanization in developed countries has led to sedentary behavior among the people, particularly younger ones. The rapid growth of legions of video games, social media, movie streaming, and binge watching seem to the prime contributors. The surge in sedentary behavior is not only a major risk factor for many chronic diseases, but is also recognized as a substantial global economic burden. Increasing physical activity and optimizing exercise as recommended by Arthritis Research UK versus Arthritis and World Health Organization is an optimal way to improve musculoskeletal health. Evidence shows that the effect of sedentary lifestyle, example desk job, can be reduced by small amount of activity every day. A recent meta-analysis utilizing the data of around 1 million individuals concluded that 1 hour moderate level activity daily can eliminate the increased risk of death associated with the 8 hours of sitting. Thus, a moderate level of physical activity remains a key requirement for healthy aging and maintaining musculoskeletal health. Sedentary behavior is a major contributor to obesity, type 2 diabetes. Likewise, obesity is also a major contributor to the development and progression of osteoarthritis, with several epidemiological studies confirming the link between adiposity, obesity, and joint degeneration. Evidence suggests that increasing the level of physical activity will not only increase musculoskeletal health, but also decrease the risk of suffering from obesity-related disease such as diabetes. Sometimes few of my patients ask the question that they have the arthritis, means they have the osteoarthritis, whether they should go for walk or not. I say when the osteoarthritis is grade 2 and grade 3, means a moderate level of osteoarthritis, walking is always helpful. I say that you should walk around 4 to 5 kilometers because with every step which you take, the cartilage presses and squeezes out the product of metabolism. And when you take the weight off, means when you lift the leg, it again uh, relaxes and sucks in the blood, sucks in the healthy fluid from the this synovial fluid, and thus helps in regeneration of cartilage. So the moderate walking is good even in second and third stage of osteoarthritis. Moderate and modest walking helps in regeneration and re-energizing the cartilage. So it is most important to walk. Those exercises elevate, and walking also improves the heart rate, known to be associated with lower lifetime risk of cardiovascular disease. Apart from rendering musculoskeletal health benefits, improvement in cardiorespiratory fitness can be achieved by changing sedentary behavior to achieve a low intensity physical activity like walking. Exercises are now widely prescribed for rehabilitation of musculoskeletal injuries and is used as a preventive health measure is now widely investigated with guidelines around the time. Frequency and duration of activity being considered. Low back pain and neck pain can be benefited by staying active and exercising regularly. Group exercises program or weight loss support, if required, can be considered to reduce the incidence of falls, balance and strength training, home hazard assessment, participation in falls prevention program, getting involved in activities like gardening, dancing, etc. helps. Osteoarthritis has been shown to be benefited from activities and exercises that improve muscles and aerobic fitness like walking, swimming, pilates, weight loss support can be rendered if required. Aging is inescapable, but it can be made easy and healthy with the help of exercises. Exercises renders many benefits to the aging body, including reducing the manifestation of aging, especially the aging phenotype of the elderly. A recent systemic review concluded physical exercise renders a positive impact on muscle mass function in healthy subjects age 60 and above by improving muscle performance by increasing the ratio of type 1 to type 2 muscle fiber, and increasing the cross-sectional area of type 2 muscle fiber. This is getting too much of technical. So, physical exercises programs improve strength and balance in aging women with osteoporosis. Additionally, fragility fracture risks associated with osteoporosis can be decreased by following an exercise program. Exercise increase bone density and reduce inflammatory markers. Thus, having an active lifestyle from early age and following recommendations for exercise could be beneficial for women. Exercises and mechanical loading also have a positive impact at the molecular, cellular, and tissue level. Like with aging, the potential for cell proliferation, number of stem progenital cells decrease in tendons. Exercise loading can induce an increase in tendon collagen synthesis, thus increasing tendon strength. Physical exercise and mechanical loading also have a positive role in maintaining cartilage and bone health. Moderate exercise could also be could also enhance the quality of tissue produced during the healing of injured tendons. Surge in sedentary behavior and unhealthy diets have caused a global obesity epidemic and diabetic epidemics. These are further great risks from the cardiovascular neurodegenerative, which further complicates the management of musculoskeletal disease. Obesity is an important comorbidity of many musculoskeletal conditions and is closely related to the development of osteoarthritis, one of the commonest musculoskeletal health issue. The strategies aimed in reducing obesity in adults will reduce the occurrence of osteoarthritis. Increasing intestinal obesity is also one of the most modifiable risk factors for osteoarthritis. Exercise and weight loss have benefited overweight and obese adults with knee osteoarthritis in many clinical trials. Thus, combining modest weight loss with moderate exercise can provide the best overall improvement in symptoms of pain and joint function. Lack of physical exercise in childhood causes childhood obesity, which further leads to musculoskeletal pain in later life. Reducing obesity in children by increasing physical activity helps the child, and it is going to go in a long way in making him a youthful adult. Furthermore, consumption of unhealthy diet and sedentary lifestyle is contributing to the increased incidence of childhood obesity. Low in nutritional value and high in caloric content foods further contributes to obesity and diabetes. Diet is inevitable and important part of healthy living. A 3-year follow-up study, including about 400 adults, showed that diets high in potassium from fruits and vegetable intake reduce the amount of muscle loss in adults more than 65 years of age. So the diet full of protein and diet high in potassium and salt reduces the amount of muscle loss. It should be noted. Dietary flavored intake from fruits and vegetables also known to be positively correlated with good bone health, that is bone mineral density and bone resorption is reduced in perimenopausal women. Improving the diet of osteoarthritis patients have also shown great benefits. Vitamin D, calcium, and particular protein consumption have also shown to optimize muscle bone and functional outcome in older patients. Dietary strategies for improving musculoskeletal health should include consumption of long-chain fatty acids, vitamin D, vitamin K, vitamin C, decreasing blood cholesterol level, antioxidant-rich diet may benefit athletes by improving tissue repair. Sarcopenia. The sarcopenia means muscle dystrophy, muscle atrophy in elderly people can be benefited by combining exercises with dietary supplements of whey protein fortified with vitamin D as it increases the muscle mass and strength. That is all in nutshell what I want to say, that everybody, a healthy adult, a sedentary adult, a retired person, a postmenopausal woman, a children, they must regularly do exercises and should take care of their diet. The diet should be rich in protein, should be rich in antioxidants. That means fruit intake should be increased. Protein intake can be increased by eating more pulses, दालें जिसे अपन बोलते हैं दाल, milk protein, cheese, and if you are non-vegetarian, you can have the fish and rest of the non-veg protein, including egg. Egg is also considered as one of the best protein source. It is called first class protein. So consumption of 3 eggs per week is sufficient to take care of your protein need. And if you are bodybuilder and if you are athlete, then you can go in for increase protein intake. That's all.